Vastus medialis attaches from the intertrochanteric line of the femur and also the medial lip of the linea aspera and the medial supracondylar line of the femur. And then it inserts into the tibial tuberosity via the patella and the patellar ligament and the tibial condyles via the... Hey everyone, Steven here with TV4, and this week's YouTube shorts are dedicated to the Vastus Medialis muscle. Vastus Medialis is one of your quadricep muscles, and it's the most medial, and one of its jobs is going to be stabilization of the patella, which makes it a very important muscle, especially in managing something like knee pain. With regard to knee pain, when the Vastus Medialis gets very, very taut and weak, what's going to happen is you're going to get a tracking issue with the patella where it's going to start to track laterally. So what you would want to do to mitigate that would be to do some strengthening exercises for the Vastus Medialis muscle. For the Vastus medialis, there are only three bones that we need to be covering, and that is going to be the femur, the patella, and the tibia. At the femur, on the lateral surface, we have the greater trochanter right over here, and then on the medial surface, we have the lesser trochanter of the femur, and then right in between there, we have the intertrochanteric line. And then on the posterior surface, I'm going to just flip Johnny around. Right over here is the linea aspera, and then if we travel down on the medial aspect, we have the medial supracondylar line of the femur, and that's it in terms of the femur. Then we have the patella. The patella is going to be your kneecap, and then just inferior to that, we have the tibia. The tibia is your big medial shin bone, so the bone closer to the inside. And then at the tibia, on the anterior surface, we have the tibial tuberosity right over here. On the lateral surface, we have the lateral condyle of the tibia. Then on the medial surface, we have the medial condyle of the tibia. But those are pretty much the only important bony landmarks when discussing the Vastus medialis. The Vastus medialis attaches from the intertrochanteric line of the femur and also the medial lip of the linea aspera and the medial supracondylar line of the femur. And then it inserts into the tibial tuberosity via the patella and the patellar ligament and the tibial condyles via the retinacular fibers. And because it crosses the knee, we know it's going to have action at that area. At the knee, its main action is going to be extension of the knee, and that's going to be its main action, but that's pretty much it in terms of the muscular anatomy for the Vastus medialis muscle. The Vastus medialis is innervated by the femoral nerve, and more specifically your L2, L3, and L4 nerve roots. And the reason that's going to be very important is because if we have any type of damage or compression to the nerve roots in those areas, then the nerves are not going to be able to send the proper signal to the Vastus medialis to fire properly, and that's going to limit blood flow and oxygen to the area, which can lead to things like low back pain, hip pain, knee pain, ankle pain, and foot pain. So you would want to address it immediately, and one of the ways in which we could address it would be to do some ELDOA exercises for the nerve roots in those areas. The reason the ELDOAs are going to be so great is because the whole purpose of an ELDOA is to create space within a joint. So if we create space within the joint, that can improve the function of the nerve roots, and then the nerves are going to be able to send the proper signal to the Vastus medialis to fire properly. Today I'm going to be taking you through a strengthening exercise for the Vastus medialis muscle, and it's going to be a variation of a reverse Nordic curl. For it, we're going to be in a tall kneeling position, and what we want to do, because we're targeting the Vastus medialis, is going to slight abduction of the femur. We're going to do that by placing the knees outside of the ankles. We want a neutral pelvis, and we don't want to go into retroversion. The reason we're avoiding going into retroversion is because we want to release tension on the rectus femoris muscle to get maximum recruitment of the Vastus medialis. Then, we want to maintain a nice tall spine. So from the external auditory meatus to the glenohumeral joint to the greater trochanter of the femur to the lateral condyle of the tibia, we want it all in one straight line. Next, we're going to go ahead and squeeze our knees together. We want to create a valgus force at the knees, and then all we want to do for the principle of action is go into as much knee flexion as possible and then come back up. But this is the strengthening exercise for the Vastus medialis muscle. Today I'm going to be taking you through a myofascial stretching exercise for the Vastus medialis muscle, and for it, we're going to be in a prone position, meaning you're going to be laying down on your stomach. The first thing you want to do, you're going to take the ipsilateral arm, so the arm of the same side that you're stretching, and you want to go ahead and grab a hold of your ankle. You want to prioritize maximum knee flexion by driving the heel toward the glute, and you want to go into medial rotation of femur by bringing your ankle outside of your hip. With the contralateral arm, maximum extension of elbow and wrist, maximum external rotation of shoulder, and then at the cervical spine, we want to do a contralateral rotation by looking away from the side that we're stretching and pin the ear down to the ground. But this is the myofascial stretching exercise for the Vastus medialis muscle. For the L3, L4, L2, we're going to start in a seated position with our legs extended and our heels touching, and then we want to flex our knees to 90 degrees. We're then going to go into dorsiflexion of ankle by pointing the toes toward our head, eversion of ankle by pointing the soles of our feet away from each other, and then drive the knees down toward the ground. We want to bring our heels as close as possible so that they're not touching. Then, we want to maintain a retroversion of pelvis, flat lumbar spine, flat thoracic, our chin is tucked in, crown of the head is up, eyes are looking down at the floor to put the dura mater under tension with the arms, maximum extension of elbow and wrist, maximum external rotation of shoulders, flex shoulders to the level coronal plane, so biceps in line with the ear. We're going up with the palms, up with the crown of the head, driving the knees down to the ground, and this is the L3, L4, ELDOA.